Welcome to today's health clip, covering the Chronic Care Management Program. This health clip is brought to you by Healthcare Partners of the North Country, your region's accountable care organization. In today's session, we're going to be discussing the Chronic Care Management, or CCM, program in detail, including a general overview of the program, eligible participants, who is eligible to bill for the service, as well as how to successfully implement the program into your practice. So why is CCM so important? CMS recognizes care management as one of the critical components of primary care that contributes to better health care for individuals, as well as reduces spending. Effectively managing those with chronic conditions is at the forefront of care management, as 2/3 of Medicare beneficiaries have 2 or more chronic conditions. These beneficiaries are among the heaviest users of healthcare services, particularly ER visits and hospitalizations. Let's turn our attention to the data depicted on the graph. You'll notice that as the number of chronic conditions increases, so does the number of ER visits. The left side of the graph shows beneficiaries with 0 or 1 chronic condition. Only 4% of them had 1 ER visit during the year. The right side of the graph shows beneficiaries with 6 or more chronic conditions. Almost 2/3 of them had at least 1 emergency room visit during the year. And what's even more alarming is that 27% of beneficiaries in this category had 3 or more ER visits during the year. The data on a national level is alarming in its own right, but how does it really impact our ACO? Well, let's take a look at our numbers. In 2015, our CCM eligible beneficiaries had 2,169 hospital admissions, which resulted in over $27 million spent. CCM is defined as 20 minutes a month of non-face-to-face clinical staff time provided to Medicare beneficiaries who have 2 or more chronic conditions. These services include communicating with the patient and other healthcare specialists, either by email or phone, medication management, and care coordination. Sound familiar? Many of these services are ones that your office is most likely already providing to your patients. Now let's talk about who is eligible to receive CCM services. Eligible patients are Medicare beneficiaries with 2 or more chronic conditions that are expected to last at least 12 months or until the death of the patient, and whose chronic conditions place the patient at a significant risk of death, acute exacerbation, decompensation, or functional decline. Here are some examples of chronic conditions. Keep in mind, this list is not all-inclusive. Alzheimer's disease and related dementia, arthritis, asthma, atrial fibrillation, autism spectrum disorders, cancer, chronic obstructive pulmonary disease, depression, heart failure, hypertension, ischemic heart disease, and osteoporosis. Now let's talk about who is eligible to bill for CCM services and who is eligible to perform the work. The CCM codes can only be billed by a physician, advanced practice nurse, or physician assistant. The clinical staff members, such as registered nurses, licensed clinical social workers, LPNs, clinical pharmacists, and CMAs, are allowed to provide CCM services to patients as long as they are supervised by the clinician. We will talk about billing in more detail on the next slide. The CPT code for chronic care management is 99490. CMS pays for the CCM service separately under the Medicare PFS. The reimbursement rate depends on geography as well as by facility and non-facility. The reimbursement for our area is $30.71 for facility and $39.51 for non-facility. It is important for patients to understand that only one of their physicians can bill for this service each month, even though they may see several providers. As you will see, there are a few CPT codes that cannot be billed during the same month as CCM. These codes include Transitional Care Management, Home Health Supervision, Hospice Care Supervision, and certain end-stage renal disease services. Another important note on this slide is that CMS requires the billing practitioner to furnish a comprehensive evaluation and management visit, annual wellness visit, or initial preventative physical examination to the patient prior to billing for CCM, and to initiate the service as part of this visit or exam. Now let's discuss the 6 steps of implementing CCM into your practice. We are going to talk about each one of the steps in more detail as we go. The first step is to identify the patients who are eligible to participate in CCM. This can be done in several ways. Healthcare Partners of the North Country can assist with this process by providing each office with a list of their eligible patients, or you can identify eligible patients using your EMR system. After you've successfully identified your eligible patients, you should then design a process specific to the needs of your practice. Healthcare Partners of the North Country can also assist with this process and implementation. The third step is to inform eligible patients of the program and obtain written consent for their participation. The patient's written consent must be documented prior to furnishing or billing for the CCM service. The written consent can be obtained during an E&M visit, annual wellness visit, or initial preventative physical exam. You can also mail an invitation letter to eligible patients. Remember, CMS requires the billing practitioner to furnish one of those 3 exams prior to billing for the CCM service. The patient consent requirements and an example of an invitation letter and consent form is provided to you in your CCM toolkit. Once a patient has agreed to participate in the program, a patient-centered comprehensive care plan should be created with the patient and kept in the EMR. Use this as an opportunity to find out from the patient what they hope to achieve and build a care plan to help meet their healthcare goals. The following elements must be included in their care plan: the problem list, expected outcome and prognosis, measurable treatment goals, symptom management, planned interventions and identification of the individuals responsible for each intervention, medication management, community and social services offered, a description of how services and agencies outside the practice will be coordinated, and a schedule for periodic review and, when applicable, revision of the care plan based on the needs of the patient. The 5th step is providing 24/7 access to care management services by way of patient portal or a dedicated phone line so that patients are able to make contact with healthcare professionals to address their urgent chronic care needs after normal office hours. The comprehensive care plan must be made available on a 24/7 basis to all practitioners within the practice whose time counts towards the time requirement for the practice to bill the CCM code. This can be done through the HIE. The final and most important step is documentation. Documentation is key to a successful CCM program due to the non-face-to-face nature of the services provided. The following information must be documented in the patient's EMR: the beneficiary consent, a detailed account of the 20 minutes of non-face-to-face services provided within a calendar month, and their comprehensive care plan. Thank you for joining us for today's health clip. Please contact us with any questions, and remember, Healthcare Partners of the North Country is here to support your office in implementing and maintaining a successful CCM program.